Good afternoon, everyone. Welcome to our webinar, What Every Long-Term Care Facility Needs to Know About Paid Sick Leave. My name is Kim Payne, and I'll be moderating today's presentation. In this presentation, we hope you'll take away some information about paid sick leave and how it may impact you in a post-COVID world. We'll be recording today's session, and the recording will be sent to you after the presentation to view on demand. We're also monitoring the Q&A and the chat panel, so if any comments or questions come up along the way, we'll do our best to address those, either during the presentation or at the end. Before we get started, I wanted to take a minute to introduce WorkSync. WorkSync is the newest offering from Attendance on Demand. It's a collaborative workforce management solution that helps you improve staffing coverage, lower labor cost to bed ratios, empower your workforce, reduce compliance risk, and improve overall employee retention. We are committed to helping our customers solve labor-related workforce challenges quickly and efficiently. Today's presenter, Beth Baerman, is our Director of Communications and is an expert in time and labor management. She has over 20 years experience in software, product management, technical communication, and training, and is a frequent speaker about labor compliance and compliance trends. Thanks, Beth. Take it away.
Okay, thanks, Kim. Well, I want to start with a question for everybody on the webinar today. So just give me an idea. How many state and local paid leave laws do you think are on the books today? And just put your messages in the chat window. I think we've got a shy crowd, Kim. I'm not sure if you see anything, but I don't, but that's okay. We won't wait. Oh, Maria's, well, you're close, but not quite there. There's actually 43 state and local laws on the books. So that's quite a few out there. And then there were also 26 just related to COVID emergency leave. So it's a big complex picture of compliance issues, which is especially difficult in LTC because you are already regulated to the high heavens. And one more thing is really difficult to deal with. So today we're going to try to take a little bit of that burden away, or at least give you tools to deal with it. So we'll talk a little bit about how we got here, where we are today, what COVID-19 has meant for paid sick leave and what it will mean in the future. We'll look at the paid sick leave laws around the country and then focus in on the key elements, the key questions that you should be able to answer in order to craft a policy that's compliant. And we're going to close with a little bit of advice on the way that you can manage things and actually make it manageable at all, because this stuff is really crazy. One thing I always have to say when talking about any of these compliance issues is that I am not an attorney. We are not giving legal advice today. Hopefully we will give you the tools that you need to talk with your attorney and make those conversations efficient and end up being compliant. So let's start with how we got here. About 15 years ago, San Francisco, California led the way. That was the first paid sick leave law enacted in the nation. At that time, only 50% of workers had access to paid sick leave. And most of them were managers, were highly paid workers, full-time workers. What that meant is that the people who could least afford to take unpaid time away from work were the people who had no paid time to take away from work. And this led to a real sense of unfairness, a sense of people wanting to protect those who are vulnerable. So it was a real grassroots movement that resulted in a city ordinance. So if we look forward 15 years and this whole patchwork of 43 different laws that we have around the country, we've seen significant impact. Today, 75% of private sector workers have access to paid sick leave. And it kind of goes across the board. Now, of course, there's still holes in that safety net. It still tends to be the lowest paid workers who don't end up having the benefit, but we've made tremendous progress, a lot of that due to all of these laws. Now, for those of you on this session today, you're probably most interested in the healthcare and social assistance slice of the market. This is a segment that the Federal Bureau of Labor Statistics follows. They do all kinds of workforce research, but their sector called healthcare and social assistance includes ambulatory healthcare services, hospitals, nursing and residential care facilities, and social assistance. So in this group, 85% of employees have access to paid leave. So way above the average across the board. Hospitals within that segment lead the way with 95%, so bring that average up. But in general, you are providing benefits to your employees, and it has made a difference. Not every sector has as good coverage as you do. And with the COVID-19 pandemic, one of the things that came to light was that not everybody had enough of a balance available to deal with being ill, to deal with being quarantined, and to deal with the risk of spreading illness to others in frontline situations, in face-to-face situations where people couldn't work from home, as in long-term care. So COVID-19 highlighted this need across the board, and it did indeed have an impact. For the first time, federal legislation guaranteeing most employees paid sick leave went into effect. The first time we had something nationwide was last year. Now, of course, this was targeted just toward absences related to COVID-19. And some healthcare employers could claim an exemption because of the emergency nature of their work, but this is still significant. Now, this legislation and the federal support for widespread paid leave ends on September 30th of this year. It started with the Family's First Coronavirus Response Act, FFCRA. So that went into effect, the first, or actually second piece of legislation in response to the COVID pandemic. It mandated paid leave, sick leave, and in narrow circumstances, FMLA leave for all public employers and private employers with fewer than 500 employees. The idea there and the give and take among the legislators was that larger employers typically already were providing paid leave. So the focus in on the smaller employees of fewer than 500. It included 2 weeks of sick leave, 10 weeks of paid FMLA. The key here is it was paid by the federal government, reimbursed through payroll tax credits. Now, the mandate, the requirement to provide that paid leave expired at the end of last year, at the end of 2020. Now, the tax credits were extended until March 31st of this year for employers who wished to continue to provide that paid leave for those employees who hadn't already used it. Well, in March, you might remember the American Rescue Plan Act of 2021 was passed, ARPA, it's called. It was a huge piece of legislation. More than $2 trillion in relief of various types for individuals and businesses impacted by the pandemic. So inside of this huge bill was an extension and in fact an expansion of the emergency sick leave and emergency FMLA that were first enacted under FFCRA. It expanded with a new sick leave balance. So even if somebody had used their 2 weeks already, they had another 2 weeks available to them, reimbursable through those federal tax credit. added support for vaccine-related absences. It also expanded qualifying reasons for paid FMLA. So pretty much any reason that you could take the sick leave for, you now could also use FMLA for. It increased the payments from 10 weeks to 12 weeks. It did not reset the balance. So we're still dealing with the same 12 weeks under FMLA as an umbrella. The other significant thing about this is that it was voluntary for employers. So currently, and until September 30th, we're in a situations where employers can voluntarily provide this COVID-related emergency paid sick leave and be reimbursed for it, but it's at the employer's discretion. Now that's just on the federal side. A lot of local and state governments have stepped up to enact their own emergency paid sick leave laws. So highlighted in blue are the states. The red dots are the cities and counties. In many cases, these laws were enacted to kind of close the gap, to include larger employers in the mix of that requirement for paid leave. Some were very similar to the federal, others differed a little bit. What's important to note is that most of these by now have expired. A few have the extension through to match the federal of September 30th, for example, California and New York. And some of the local cities match their expiration with the state or city's state of emergency. Most of them are expired, some of them are still in effect, but we're really winding down on these. The point here is that much like the standard traditional paid sick leave, the states and local governments stepped up when they felt not enough was being done to place their own requirements where employers had to figure out how to comply. This is, as I mentioned, winding down, but there's a longer term impact of all of this. The pandemic created a recognition of need across the board in general for paid sick leave. It already, with many of those beyond, in fact, many of those state and local laws that we just saw pictured on the map, many states that had existing laws tweaked some of those laws and regulations so that an emergency balance would automatically kick in the next time there's a public health emergency like COVID. And in Colorado, the latest state to enact a paid sick leave, long-term permanent paid sick leave law, Colorado did it in the context of pandemic leave. So the same piece of legislation instituted emergency balance of paid sick leave available to employees, but also put into effect an ongoing accrual of sick leave that is in effect for all employees working in Colorado, not just for the duration of the pandemic. So where are we today with paid sick leave around the country? As I just mentioned, Colorado has enacted, but there are a lot of other states, as you can see pictured on this map, that already have paid sick leave in place, and many jurisdictions with the red dots that have paid sick leave in place. Now, there's a lot of overlap here, so I'm going to quickly place the jurisdictions up on the slide so you can look alphabetically by state and city just to verify where your employees work. Do you have something that affects you now in terms of paid sick leave? A couple of asterisks with Long Beach, that's hotel workers, so not affecting long-term care. In Cook County, Illinois, part of that ordinance is that local municipalities can choose to opt out, and a number of them have. If we look down to New York, Westchester County's paid sick leave got sunsetted when the state law came into effect with the same terms and conditions. The asterisk is still there because their safe leave is still in effect, and we'll talk about safe time in just a minute. In Texas, what's important to note is that 3 cities in Texas have taken that step to require paid sick leave. They're all enjoined They're all on hold right now. We're waiting for the Supreme Court in Texas to rule on whether those municipalities had the authority to enact those laws. So they're on hold and looking for a response from the Supreme Court of Texas. And the other asterisk there is CTAG Washington, which applies just to transportation and hotel workers. So that's the picture around the country today in terms of coverage. Pretty widespread, 43 jurisdictions. We also have on the books now an executive order for federal contractors. So federal contractors have to provide paid leave to employees working on the federal contracts. In addition, and really significantly for what we're talking about today, is the Healthy Families Act. This is a bill that was introduced in April of this year. So we have a bill that's in Congress right now that would guarantee earned sick leave to employees in the US. This bill has been introduced 5 times before. So this is the 6th time that Democrats have introduced the Healthy Families Act. It never got anywhere in the 5 previous sessions of Congress. The president has signaled that he's receptive to this. We obviously have a Democratic Congress right now, so we'll see if this moves ahead. And the pandemic has sort of paved the way for much more likelihood of success now than we have had in the past 5 sessions of Congress. So we'll keep an eye on that one. So you have a sense of the coverage, where in the country we have these paid sick leave laws. If you have employees working in any of those jurisdictions, there's key questions that you should be able to answer. And the answers lie in the fine print of the laws. So let's cover those questions. First, who? Who does this apply to, both on the employee side and on the employer side? When it comes to employers, there's sometimes exemptions for very small employers. So depending on where you are, if you're under 15 employees or under 25 employees, or in Michigan, if you're under 50 employees, the law does not apply to you. Sometimes there are specific industry or union exclusions if all the employees are covered by a bargaining agreement that also covers paid sick leave. Long-term care is typically not an industry that's excluded, so this one probably doesn't apply to you. There's also public employer exclusions in some of these laws. So there are, city, county, state-run long-term care facilities that might be something to look into. The next one is employees. Now, typically, benefit policies around paid sick leave, paid vacation time, et cetera, sometimes distinguish between full-time and part-time employees. Not the case here. Typically, the only eligibility is how much does the employee work in a particular jurisdiction. Now, in long-term care, where you just come to the facility to work, there's not a lot to think about. If your facility is in one of these jurisdictions, your employees are going to be covered. But there are some circumstances, for example, if you operate a number of facilities in the greater Philadelphia area, one facility inside the city limits, your other facilities in the suburbs, then you have people who might be working in Philadelphia, but also in your other facilities. How much time are they working in that jurisdiction to qualify for that leave? Sometimes it's a couple of hours each week. Sometimes there's a monthly amount, sometimes a yearly amount, but these are things that you should look for. The next question is how much? How much time is owed to the employees? So the first portion of that is the accrual rate. All of these laws have employees earning their paid leave as they complete a certain number of hours of work. When these laws first started going into effect, it was 1 hour of sick leave for every 30 hours worked. But that's not always the case. So you do have to look. In Michigan, for example, it's an hour for every 35 hours worked. In Vermont, it's an hour for every 52 hours worked. In Connecticut, it's an hour for every 40 hours worked. So make sure you know. When does it start to accrue? Most of the time, it starts to accrue the minute they start working. But make sure, sometimes there could be a delay of maybe 30 days. And then can you as an employer cap how much an employee can accrue in each year. The year might be a calendar year, your fiscal year, a benefit year, an anniversary year for the employee. However you manage that time, can you cap it during the year? Sometimes you're allowed to cap, for example, at 40 hours or 48 hours earned in a year. Then the question is, how does the employee get to use that time? In some cases, especially if there isn't a cap on how much an employee can earn in a year, there might be a cap on how much they can use in a year. They might be able to earn up to 48 hours, but as an employer, you could choose to cap the usage at 40 hours. Anything more that they'd earned would carry over to the next year. In many cases, there's also a minimum usage increment. So that says to the employees that if you're going to use this time, you have to take it at least an hour or more, or at least 2 hours or more to make it easier to administer. And then know the reasons. When can the employee take this leave? And those reasons revolve in a couple of areas. One is the definition of family. So all of these laws allow the employee to take time for their own health and well-being and to support family members. But the definition of family isn't always the same from law to law. Some include domestic partners, some include domestic partners' children, and others don't. And in Emeryville, California, which is my favorite, service dogs are part of the family. So you can use this time to take your service dog to the vet. Some of these laws include what's called safe time, like Westchester County, New York. Safe time is time that the employee takes away from work to deal with issues around domestic violence, stalking, or rape. Now, in addition to safe time and sick time, sometimes there's provisions also for things like public safety emergencies, for parental meetings at school when there's a special education plan in place for a child, things like that. And 2 states that I included in this presentation, Maine and Nevada, because of the way they accrue their leave and the way its balances and so on are managed, these 2 states have what's called no reason leave. This is just time the employee earns and they can take off for any reason. It doesn't have to fall under sick time or safe time or specific uses stated in the law. So once you know how it's accrued, how it can be used, the next question is, how is that time paid? What rate is the employee paid? Most of the time, these laws refer to a regular rate of pay. That term, if you know much about the Fair Labor Standards Act and the overtime laws for employees, you might know that the regular rate of pay is a weighted average. So if employees work, for example, different jobs and earn different rates, if you have a CNA who also works as a feeding assistant or a bath aide and you pay them all at different rates, it's the weighted average of the different rates and different amounts that they've earned. What's tricky about the paid leave laws is it's not always in the overtime week, the way that FLSA works. Sometimes it's the weighted average of the previous pay period or of the current week, or I'm sorry, if you're in Berkeley, California, it's the weighted average of full pay periods over the previous 90 days. Ouch, that one's a tough one to figure out. One trend that we've also recently been seeing is that you are to pay the sick leave at the rate the employee would have earned had they worked. So this is true in Oregon, Washington, Rhode Island. If an employee is scheduled to work an afternoon or night shift where they would earn a shift premium, that means you have to pay their sick time out and include that shift premium in their pay. It does not include overtime. If they are sick on the last shift of the week and they would have gone into overtime, you don't have to include the overtime rate, but you do have to include shift differentials. You do have to include a job premium if they're scheduled to work in a different job. The last question to ask is, how do you manage the balance? So employees earn time, well, then what? One question is, can that time be front loaded? So far we've been talking about employees earning this time after they work a certain number of hours. In some cases, if you don't want to deal with the complexity of that, if that's too hard for employees to understand or too hard for you to manage, sometimes you're allowed to give employees as much as they would have been allowed to earn in a year upfront every year. You can do what's called front loading, and then you don't have to deal with the continuous accrual. If an employee has a balance, whether they've earned it or whether it's front loaded, does it carry over? Most of the time, if it's front loaded, it doesn't carry over, it just gets reset. In other cases, time that's earned typically does carry over, but sometimes as an employer, you can cap that amount that carries over. If somebody's earned a lot of sick time during the year, but not taken any of it, maybe it doesn't all carry forward. Maybe just 24 hours or just 40 hours carries forward to the next year. Another fly in the ointment with this is that a lot of these laws require you to reinstate an employee's balance if they quit and come back. So if they leave your employment and they come back within a year or within 6 months, you're required to reinstate the sick leave balance that they had earned prior to when they left, the last time they worked for you. So this creates a big burden for record keeping when it comes to the separation with employees. You have to keep track of how much sick time they had earned. The last thing to know about balances is that sometimes you're required to report the available balance to the employee on a specific cadence. In California, for example, you're expected to print the available balance on the employee's pay stub. If you can't do that, then at every pay period. Other times it's once a month. So take a look at that. So now that you have all these questions answered, you've looked at the laws, you can answer all those questions about how it's accrued, how it's used, how you manage the balance, the rate that you pay it out at. The next thing is to craft your own policy for how you're putting all of this into action in your organization. Especially in healthcare, most of you already have paid sick leave policies. If one of these laws comes into play for you, the question is, I already have paid sick leave. Do I have to worry about this? And the answer to that question is, it depends. You can have a paid sick leave policy, and it doesn't matter what you call it. You can call it PTO, you can call it whatever. If it satisfies all of the aspects of the law. So if it's equal to or more generous to the employee than the law in all ways, you're okay. You don't have to do anything. But there's a few things that you should verify. Make sure that all of the usage is covered. Safe time, the definition of family for employees taking this leave. Make sure that you're managing the accrual, the carryover, any caps, that everything that you do and the way you treat that sick time or that PTO or whatever it is that you call it, that you're treating it in a way that's at least as generous to the employee as that law. And then the kicker really is the pay rules, especially for those areas that require you to pay at what the employee would have earned. If there might be a shift differential situation coming into play, if the employee works a bunch of different jobs, which job at which rate would they have earned the time off? So if you check all of those boxes, you're okay. You don't have to make any changes. That's typically not the case, but maybe it'll work for you. Sometimes you're subject to more than one of these laws. We saw on that map a lot of overlap. A lot of the states that were blue also had the little dots that were red. And like any other law, every law that applies to your jurisdiction, you have to comply with. What that means is that you have to create a sick leave policy that complies with more than one law. a city law and a state law, for example. If the federal law gets passed, and if it doesn't preempt all the local laws, well, you're going to have that level to deal with as well. So how do you accomplish that? Well, look at each of the laws that applies to your location, answer all of those questions we just talked about, and compare the answers. Pick the one that's most generous to the employee for each of those questions, and that's the policy. That's how you make sure that you comply with all of them. If you've got facilities in multiple states or multiple cities that are covered by these different local laws, now you have yet one more question that you need to address. Are you going to have multiple policies with different rules for each of the different jurisdictions that you're in? Or are you going to have one policy that complies with all of them and treat all of your employees the same way? They're both legal, they're both valid. It's something for you to decide. Most employers that I've spoken to come up with one policy. It's easier to administer one policy and get it right, and employees tend to like it better. There's less comparison, less competition, less feelings that you're being treated unfairly when everybody's treated the same. So in that case, it's just like we talked about before, when you're covered by multiple laws, you answer the questions for all of them, compare the answers, take bits and pieces, and craft one policy that makes sure that you're compliant with all of the laws in the different areas where your facilities are located. So we've covered a lot, and we've really only covered how do you get to the point where you have a policy. That's a lot in and of itself. Then there's administering the policy, managing that day-to-day burden, which is by no means an easy task. Well, the only thing that you can do really is to automate it. Handling this on a manual basis is daunting. The idea of doing that is very, very difficult. The good news is that a good workforce management system can do it all for you. So what I want to encourage you to do today is to talk to your vendor. If you don't have one or don't have one that you like, put on your list some of these items as you're looking for a new vendor. So talk about accrual calculations and leave yourself flexibility by ensuring that your workforce management system can handle different accrual rates for different groups of employees. That gives you the flexibility to have multiple policies if you want to do that now or sometime in the future. Make sure that your workforce management system can appropriately manage the caps for accrual or for usage and the carryover and carryover limits that might be in place. Something that people often don't think about is automating leave requests. And when it comes to complying with these laws, the benefit you have is that an automated leave request system can enforce a minimum use increment. So it can require that employees take at least 1 hour or at least 2 hours as allowed by some of these laws. Then look at how the information about these balances is communicated to employees. Self-service portals are great for a lot of reasons. They let you comply by reporting balances to employees on demand, but also they really help to reduce the number of questions that get escalated to managers and to HR when it comes to how much sick time do I have available. Lastly, look at integration. If you're in California, if you're other places where these balances are expected to be printed on a pay stub, you need to get this information to payroll so that can all happen seamlessly without any intervention from you. It can all be automated. So in wrap up, we've really covered a lot. we've covered a lot of ground today. So the two key things that if all you take away from today's session are just two things, remember that you need to look at the law to get answers to those key questions. Who gets paid sick leave? How much paid sick leave is earned? How is it used? What rate do you pay it at? And how do you manage those balances? Get those answers from the ordinance itself. Then use a workforce management system to relieve that burden, to automate the rules and the record keeping and take that off the shoulders of your supervisors and your HR staff. So with that, Kim, I'm going to turn it back over to you to see if we have any questions today.
Sure, thanks, Beth. And as a reminder, anyone with questions, feel free to drop it in the chat or the Q&A panel. I'm monitoring both, so we won't miss it. A couple of things have come in through the chat as we've been talking here. The first question, Carrie asks, would a single PTO bank satisfy these laws? Would we have one PTO bank to cover sick and vacation time?
Well, the answer to that is yes. And that's a pretty common question. And for a while, that was a real trend to just have one PTO bank and not separate out vacation time and sick time, et cetera. So it's okay to have one bank. And even if you're using it to cover vacation and sick, as long as you accrue enough time to answer that question on how much, and as long as you allow the employees to use it for all those reasons that we talked about, make sure it covers safe time and sick time and time away with family member issues and things like that, you are good, and that is sufficient. And you can still call it PTO. You don't have to call it sick time.
Okay. So I see a question just came in from Samantha. OSHA may have new temporary standards for healthcare facilities. Is there any guidance on how to compare state, local laws with OSHA ETS effective June, July 2021? It's pretty specific, but maybe we can take a stab.
It is pretty specific, and I don't know that I'm familiar enough with the OSHA. Some of those I've looked at because I know, I've been involved on our coronavirus task force here at work and looking at all those laws. The OSHA stuff, especially with the emergency rules that are still in place for the healthcare, is still related to the COVID emergency and the COVID emergency leave. So that balance typically has been completely separate from the balances for these earned sick leave laws. And in fact, they were kind of above and beyond. And for the most part, you couldn't require employees to use their existing paid sick leave balance. They could use their new balance under the emergency COVID rules first before they could touch any of their other PTO balances. So I would encourage you to look. I can't give you an absolute answer here, but I would encourage you to look at those rules specifically for just those phrases about that it's independent from the other benefits that you have in place. And if my memory serves me correctly, it is. But again, I think I can't give you a specific definitive answer on that one.
Thanks. Okay. Let's see. So Scott has a question. We have some staff who regularly work at our facility, but our agency staff, do we have to pay their sick time?
The sick time, it's a good question, because employees earn sick time based on where they work, but that doesn't mean that where they work is the person who actually has to foot the bill. So if these employees are not your employees, even though they work at your facility, if they're employees of a agency or a staffing service, then it's that agency or staffing service that needs to pay. And I'm sure that you're already reporting hours so that those employees can be paid correctly they are responsible for calculating the amount of the paid sick leave owed and making that available to the employees.
Cool. We do have a time for more questions, so if anything comes up as we have this Q&A, please feel free to ask. Another question just came in. Lauren asks, would contingent workers earn paid sick leave under the state law going into effect in New Mexico next year?
New Mexico is one that's coming up, and like really all of the other laws, these laws don't set out different classes of workers. Part-time workers, full-time workers, contingent workers, anybody who's employed by you will be subject to these laws. So a contingent worker, if you mean that that worker is employed by your facility, but they just work for example, like a certain 1 weekend a month, or within a quarter, 3 weekends during the quarter, that kind of thing, for contingent workers, as long as they're employed by you, yes, they would earn it. You would be required to track it. You would be required to maintain a balance and to pay it out if they use that time.
Okay, here's another one. What if we provide more sick leave than the law in our state calls for?
Then you're a great place to work, and congratulations. But yes, you are always allowed to be more generous to the employees. All of these rules are establishing a floor. So you have to do at minimum that, but you can always choose to be more generous and provide more. You don't have to scale back to absolutely meet and treat your policy exactly the way the law is written.
Okay. Last call for questions. We're coming up just at around the end of our session. And if we don't get to you today, I promise we'll follow up via email with any questions you may have about this topic. But for now, I would like to thank you all for attending today's presentation. A few of you asked if we're sharing our slides. We're actually going to share this in a follow-up email. We're also going to share this recording so that you can send anyone who needs to know this information our way. We're happy to give this to you. We also have a white paper with additional information that can help to support any questions you may have. We'll be sending that along as a follow-up. And we really appreciate you taking your time to join us today.